Hi there, it's about Medicare and what's going on. Somebody's getting arrested, possibly going to jail about Medicare Advantage fraud. Oh, the shock and the irony of it all. We also have a strike still going on with those callers that we tell you to call if you have questions about your Medicare coverage. Those are the people over at Medicare.gov. I have their video, their press conference that you should really watch if you want to know who's supposed to take care of the 60 million people on Medicare when you call in for questions. That's going to be at the end of this video. Don't miss that. And one of my haters reached out. Didn't think that I'd have the courage to read his nastiness, but actually some of it is quite hilarious. So I'm going to share that with you as well. Also, there's another bill that just got proposed by the U.S. Senate. It might help some of this Medicare Advantage stuff that's going on. So let's get right into it. The worker strike is still on. Thousands of people are striking, and these are the people who are supposed to answer the questions. Answer the phone when you call 1-800-633-4227. That is the Medicare number. And these people are not going to be there. This is what they look like. They want you to join their cause. They're demanding $25 an hour, better benefits, better bathroom breaks, and the like. And so hopefully they'll get what they want so they can go back to helping the seniors take care of themselves. Just for those that don't know, if you do call Medicare.gov, they have the information about Medicare Advantage plans. They don't have much information at all, except to give you a phone number to an insurance company, maybe, on Medicare Supplement. They don't understand Medicare Supplement, also known as Medigap. They don't typically understand the state rules regarding Medicare Supplement because those are administered by the states and not by the federal government. So if you are calling Medicare hoping that they can explain to you the difference between a Plan G and a Plan N, don't hold your breath. But actually, they're not there right now answering the phone anyway. This is sick. This will probably cause a special election period. I'm just saying, based on experience, this will probably cause a special election period and allow Medicare in the future to extend the time that you had to make a decision past December 7th. But don't want to give you that as a hard and fast rule. But if there's nobody there to help you and you're calling in, what else are they going to do, right? This is a friend of mine, 𝗫𝗏𝗄𝗃. Let me tell you, she is amazing. This is an update on the city of New York City retirees. They tried to take away from them their Medicare supplement plan and shove them into a Medicare Advantage plan. And Marianne here used to be a firefighter with New York City Fire Department. She used to help people all the time. And she knows the difference. She researched the difference. She learned all about prior authorization. We had many conversations about this, the stories, the good, the bad. She went back to them and pushed back and asked them questions about it. And she actually got them to change their proposal to limit the amount of things that their Medicare Advantage plan would give restrictions of prior authorization for. However, it still didn't get good enough. And this is a great update. They've won 3 different times in court, and the city is now appealing that. Mayor Eric Adams, who's now the mayor, came into the mayorship promising that he would help the city retirees. But then he changed his mind once he got in and he saw this lure of $600 million that they could save if they all went to the Aetna Medicare Advantage plan. They've won, but now they're facing 3 different appeals at the same time. Last night, she put out this video saying, would you please donate to us? I donated $1,000. I think if anybody wants to help these people who are firefighters, EMTs, police that have put their lives on the line with New York City, they are winning the case because they were promised benefits. And unlike so many other cities and states and companies who have rolled over, when the companies have said, you know what, we promised you lifetime benefits, but now we're taking that away. We're going to give you this wonderful, super awesome plan that has all kinds of perks like dental, vision, hearing, and all the rest. They went for it. New York City retirees are fighting back because of Marianne's group. So please look at their website, nycretirees.org, and consider making a donation. It's a great group of people, and we should be supporting them, especially in light of what they've gone through with 9/11. And these are a lot of the people that are retired now that were in that era. So I'm supporting them, and I encourage you to do the same thing. Good people there. So we have a charge by the FBI. First one since 2016. See, they constantly come after these Medicare Advantage companies, and they'll just say, look, you took millions of dollars from us. We want you to return that money. We want to give it back. And then the insurance companies are like, hey, can we talk about this for a while? And they go on and on and on. And it seems like they just keep the money. It's just absolutely bizarre how that works. But in this case, they're actually filing charges. How do you like my image there? This is my little artificial intelligence image. I thought it looks pretty cool. You just describe it to it and it comes up with that. But yeah, in this case, they've got a criminal charge A former executive at Medicare Advantage organization charged with multi-million-dollar fraud scheme. This is right from the U.S. Department of Justice. The Justice Department announced charges against a former executive at HealthSun Health Plans, a Medicare Advantage organization in Florida that operates, in Florida. For her role in multi-million-dollar scheme, she's being charged. According to court documents, Ms. 𝗲𝗁 of Miami, formerly the director of risk management, how ironic, of analytics. Let's see. She allegedly organized a scheme to submit false and fraudulent information to CMS to increase the amount that HealthSun receives from Medicare Advantage enrollees. So much fraud. CMS pays Medicare Advantage plans like HealthSun operates based in part on the health condition of their enrollees. We talked about that yesterday. To increase the company's profits and their own compensation. This has been rampant fraud for years, and it's not just them. If you Google search upcoding and Medicare Advantage, the word is upcoding. That's what they're doing here. She and her co-conspirators are alleged to have knowingly submitted and caused the submission to CMS of false and fraudulent information about chronic ailments that Medicare beneficiaries and HealthSun's plans did not actually have, and that non-health care providers such as coders added to patient health records. For example, they allegedly entered and caused others to enter diagnosis on the medical records to beneficiaries enrolled in HealthSun's plans based on diagnostic tests that were not proper basis for So I told you this a few years ago, and what this upcoding thing has really had a negative impact on people in a substantial way, because we'll go later to our clients who say, by the way, do y'all do life insurance? Yeah, we do life insurance. So we can help them with life insurance. And as soon as they go to script check, they go on the MIB and they go to look at their health records online, which yes, you can do. They find all these negative things. Really? I don't have COPD. I don't have chronic diabetes. I don't have that condition. Well, guess what? Somebody at your Medicare Advantage plan upcoded your butt and made it look like you did. So now your health record shows this inaccurate information. And that's one of the real life consequences of what they think is a victimless crime, not just the taxpayers. Yeah, it does victimize people. Yep, the chronic conditions. Yep. And then see, we're going backwards here. They entered, and in addition, they allegedly obtained the login credentials assigned to certain physicians to wrongly access medical health records and submit this stuff. Yeah, tens of thousands of false claims. She's charged only with this. Way to go, DOJ. She's charged with 1 count of conspiracy to commit healthcare fraud and wire fraud, 2 counts of wire fraud, 2 counts, tens of thousands of claims, and 3 counts of major fraud against the United States. 3 counts. If convicted, she faces a maximum penalty of only 20 years in prison on the conspiracy count, and on each of the wired fraud count. It doesn't matter. This is going to be a slap on the wrist. An indictment, by the way, just in full disclosure, an indictment is merely an allegation. All defendants are innocent until proven guilty in a court of law. Have you ever seen the show Cops? They literally used to play that song over the speakers of my patrol car when I had a bad guy in the back. When I became a police officer in 90, I can't remember what year that was. Gosh, I was 19 years old in Florida. You can be a cop in Florida. And they were crazy enough to give me a badge and a gun. Isn't that just nuts? The bill coming out that's proposed, hopefully, is from Senators Bill Cassidy, who's a doctor, Catherine Cortez Masto, Elizabeth Warren, who we had an amazing performance the other day, just grilling the heck out of that guy who was nominated by the Biden administration to be on the Medicare trustee board. Man, if you didn't see that video, you really should. She did a great job. And Marsha Blackburn, who my son just had his picture taken with at an event the other day, introduced legislation to improve transparency of Medicare Advantage plans. That's what we need. And ensure these plans are best serving America's healthcare needs. The Encounter Data Enhancement Act would require Medicare Advantage plans to report important information about how much they are actually paying for patient services and how much patients are responsible for paying out of pocket. Quote, just as price transparency is good for patients, data transparency is good for the federal taxpayer, Dr. Cassidy said. Specifically, transparency allows taxpayers a better understanding of how the hundreds of billions of dollars are going for the Medicare program being used, and answering the question of if the money can be used in a better way. American taxpayers are paying hundreds of billions of dollars. Isn't that crazy? Hundreds of billions of dollars for seniors to use Medicare Advantage plans, but the federal government still doesn't know how much these plans are paying for patient services or how much patients are being forced to pay out of pocket. Isn't that something? My bipartisan legislation will ensure that these plans are transparent, helping us conduct appropriate oversight and provide seniors with the best possible healthcare information. For years, Medicare Advantage plans have been using a long list of tricks. This is Senator Elizabeth Warren's favorite word. Tricks to overcharge the government for coverage, just like we talked about a minute ago with the upcoding, while delaying and denying care for seniors. Say it ain't so. By strengthening data transparency, this bipartisan bill will empower lawmakers and regulators to rein in this fraud and abuse and ensure taxpayer dollars are being used to deliver high-quality coverage for Medicare beneficiaries. I sure hope that happens. I'm going to show you my hate mail. Are you ready? If you're offended, please look away, because I'm going to show you the real thing. Minor redactions, because it's horrible. If you've liked anything of my videos ever in the past, please do me a favor and like this video. If you've not yet subscribed, and 70% of the people watching are not subscribed, they get their answer and then they go away. And here's the worst part. When they do that, they'll send in a comment and say, what's the difference between a Medicare supplement and a Medicare Advantage plan? Well, I just covered that in the last 30 videos. So if you should subscribe, go to the channel and see the coverage that we've done on the different types of Medicare plans, the different options that are available to you, because most of the people in the market today, the agents, are not going to share you that information, but I am, and it's probably already been covered on this channel. 9.4 million views so far, and you're one of them. So thank you for doing that. Please like and share this information on your Facebook page. Just copy the link up above and share this and say, hey, some interesting things happening with Medicare. You guys should follow this guy. Here's the hater right here. Current situation, 65, signed up for Medicare, United Healthcare. Why? Now, by the way, I've mentioned United Healthcare once in the last year on my channel. Just for context. About a year later, I fell off a ladder, broke backbones and 2 ribs, went to a hospital in network less than a mile away, stayed there for 3 to 4 days, then almost a month in a skilled nursing facility next to a hospital. Went home, many more months of recovery, had to pay $500 out of pocket. Not bad considering, and I would say you're absolutely right. So what's your problem, dude? Somebody at United Healthcare kick your dog, blank your mama, beat up and blank your wife. I have never seen somebody with more. Oh, I should have taken out more of this. Oh gosh, yeah, I left that in there. My bad. Didn't redact enough. Anyway, God bless you. You've got some issues, and I love the hate, because what they say is if you don't have haters, you're really not doing anything out there. So let me share with you some not hate. This is about the latest video that we did. CT scan just found a nodule in my lung that is growing at a malignant doubling rate. My local hospital is great with hearts, but it hasn't even called me back in over a week now. That's crazy if you got some possible cancer. I'm firing them and moving my case to University of Washington's Fred Hutch Cancer Center, a few states away, because you can do that on a Medicare supplement plan. And thank God I don't need to ask anyone or get anyone's approval. Yeah, that's absolutely true. Thank God indeed. Because I have real Medicare and a real Medicare supplement plan in. When cancer is doing this, delays are life-threatening. You won't sleep much while waiting. That's what the senator said in the video yesterday. Pre-approvals are life-threatening from the delay alone, and then they might deny it. I'm so grateful to have great insurance, largely because of Christopher Westphal. I regret I signed up with a local agent, but followed Chris's advice. That's okay. So he doesn't even get paid for it. I didn't know how commissions worked back then. If you want to know, you go to my website called howdoyougetpaid.com. Howdoyougetpaid.com. I explain how we get paid. But now I do, and it sickens me that seniors like me are being stuffed into not Medicare and not an Advantage plan to make the salesperson and the insurance companies rich. Thank you again, Chris. I think finally of you every time I don't have to have a pre-approval, and every time I get to go to anyone I want and don't need them to be in network. Insist on real Medicare and a real supplement, and tell your Medicare medical providers that you have them and don't need pre-approvals for networks, this and that. They will get to your case a lot faster. My doctor recently put it right on her phone message that she is no longer serving those with one company. Can't blame her. Oh, forgot to put my sign on outside that says live on the air. Sorry. 2 weeks ago, I had a reason to call my drug plan. This goes back to what I have on my website. That's for starting drug plans. If you're not familiar with that, if you need to know like a good place where you can go and find out what drug plans are available for you, the Part D standalone plans, you can do that right there at startpartd.com. 2 weeks ago, I had a reason to call my drug plan. I was transferred to a salesperson who grilled me in Eppley to sign up for a Medicare Advantage plan. Say it ain't so. If you go to my website, it streams across the bottom. This is going to happen. They're going to give you a sales pitch. Wait for it. Every question I asked was passed over. After 1 hour of a grueling sales pitch, I hung up. After repeated callbacks, I read them the riot act. Nope, not me, not calling back ever again. I thank God that I listened to you when I first started on Medicare in 2014. I still have original Medicare with a supplement plan in. I do not have the worries of services being denied or where I can be seen. All the procedures that I have had done have been covered by both Medicare and my supplement, with sometimes only a copay of $20 to deal with. Thank you, Chris, and all that you do. I told my agents the other day, because they're getting pretty tired. We're working very, very long hours. We're trying to help as many people as possible. And I said, you should read some of the positive comments on YouTube, because people are giving their feedback as to how we're actually helping them and improving their lives. We always want to put somebody in a better position than they were when they came to us. Had a transplant. A couple of years later, I ran into a Medicare expert. Let's see how that worked out. Uh-oh. Oh my goodness. Hi. Somebody just came to see me. You come over here.
She spilled her milk on her, so she's wet on the
This is my granddaughter, Scarlett. Hi, Hannah. And my Hannah is hiding over there. You can see her. Oh, wait. No, can't get there. Hi, girls. Thanks for coming to see me. Look, Scarlett. Is that Grandpa? Look up here. Look. Up there. That's Grandpa on the screen. We're talking about Medicare today. We're trying to help people. Can you give me a high five? Can you give me 5? Look, I have your dancing fruit on the TV over there. Yeah. All right, Scarlett's going to join me for the last part here. So this person needed a transplant, and a couple years later ran into a Medicare expert. Oh, let me show you what they're doing here. At least you can see that part. Oh, let's go over here. Who talked me into an Advantage plan, which I had never heard of and didn't know how it worked. She assured me that my meds were covered. When I started to have to pay high prices for anti-rejection drugs, because remember, on a Medicare Advantage plan, they just throw a drug plan in there for you. It's not one necessarily customized for you. That's a problem. And it took a while until someone explained I'd been removed from Medicare when Part B pays for transplant meds, as it had covered the transplant. It's great. I have a video about drugs that you don't know about, and it's about Part B. I'll link that up here when the live stream's over so you can see that. And having Part B pay for your drugs is a great thing when you have a supplement, because it's all paid for. After months of aggravation, I was taken back by original Medicare, but can't get a supplement plan because of the transplant. And that is why we try to educate people. I hate those Advantage plans and the celebrities who get paid to recommend them. It is fraud. It's just not my words, y'all. You have a great program that truly helps people. I'm a nurse since 1968. Well, that's awesome. And I've seen it all. For seniors, no, I got her. She's doing fine. For seniors, original traditional Medicare is the way to go. This gentleman knows what's going on, and he's very helpful. Good luck and good health all. Scarlett, you're such a good helper. You're helping Grandpa. Last one I'll go into here. Hey, I got a story for you. Yesterday, I received a letter from Humana, which I have Medicare Part D with. That's the drug plan. In the letter, it thanked me for my application for their Gold Plus plan using Medicare Advantage, and that Medicare was reviewing the application for approval. Now, I only have Humana prescription plan with no Advantage. Tell him, Scarlett. Tell him. I called Humana and spoke to several people before I found out that someone had answered my question. She asked me if I ever talked to them, gave them a name, which I talked to, never talked to anyone from Humana. So basically, this person got flipped. They called maybe about their drug plan, and they flipped them to a Medicare Advantage plan. Again, warning, that's what their big incentive is to do, is to put you on Medicare Advantage. Story after story after story. There's 2 different ways to go on Medicare. Original Medicare and a Medicare Advantage plan. Please look at my channel so we can educate you on that. And if you look at this, I got a thing here. You can see, well, maybe I can't find it. It's called allaboutmedicareadvantage.com. There it is. If you want a real education on the differences, look at allaboutmedicareadvantage.com, because it took a lot of time to put that together for you. And if you need help with your Medicare plan, reach out to the office here. Oh, that's blocking Scarlett's cute face. and we can help you. I'm Chris Westfall. Thanks for being here, y'all. God bless you and your family, and stay safe during this crazy Medicare season. Scarlett, can you try to say bye-bye? Can you say bye-bye? Bye-bye. Not quite yet. She's 8 months old. She's working on communication. You say all done. What's the thing when you do the sign language? All done, like this? All done. You do all done. You show them how cute your face is? They're not in the microphone. They're in the camera. Look, right here. Look, Scarlett, right here. Look at that. It's Grandpa up there. Isn't that cute? Bye, y'all. Please keep sending the comments, even if they're hateful. I enjoy reading them. Read as much as we can. And Scarlett and Hannah came to visit me at work today. I'm a blessed man. Bye, y'all.
So welcome to members of the press, Maximus workers, and our community allies through our National Press Conference. If you're a member of the press, please feel free to submit a question through our Q&A feature, and we'll answer them at the end. So my name is Adriana Lewis, and I worked at the Maximus Call Center in Hattiesburg for 2 years. I'm a dual CSR, meaning I handle both Medicare and Obama calls, and I'll be your MC for today. Today, 100 of call center workers at 8 Maximus federal locations in Hattiesburg, Mississippi, Bogalusa, Louisiana, Riverview and Tampa, Florida, Chester, Virginia, Phoenix, Arizona, and Albany, New York, and London, Kentucky went on strike to demand living wages of at least $25 per hour, affordable health care, and the freedom to form a union without intimidation and interference. Maximus is the largest federal call center contractor and collected $2.2 billion from the federal government last year alone. The Department of Health and Human Services is Maximus' single largest customer, including $6.6 billion contracts to provide Medicare and Obamacare call center services, where it employs about 10,000 workers. In addition to a major CDC call center contractor, the Maximus workers on strike today work under these two HHS call center contracts. Today, we'll be hearing from striking Maximus workers like me, in addition to allies who are supporting us in the fight for justice, such as CWA President Claude Cummings Jr. and Stacey Abrams. So since I began working at Maximus during the pandemic, I saw how poorly Maximus treated us, and that's why I joined the union, organizing for better working conditions and a voice on the job. Our employer and its leadership are spreading a sense of intimidation and fear to interfere with our American right of free speech and to unionize. You're here today for some of my coworkers who are struggling to make ends meet on bare minimum pay and benefits that we get as workers on a federal contract, serving millions of Americans. We're also here today to call on the Biden administration to follow through on this commitment to use federal money to create good jobs, not bad dead-end jobs like the one at Maximus.
First and foremost, I want to encourage the hundreds of workers at Maximus and Maximus subcontractors across 8 locations in 7 states who put their phones down and their fists up. The 10,000 federal call center workers at Maximus, most of whom are women of color in the South, are facing unacceptable working conditions. Despite being essential workers performing a vital service for the federal government and millions of Americans, Maximus workers and your families are forced to scrape by. I've met many call center workers at Maximus who can't pay their bills on the wages and benefits that they get, only around $16 to $17 per hour in most cases. At Maximus, many workers have not received a raise in over 2 years, despite the high rates of inflation. And in the face of a Biden administration that has failed to take any meaningful action to address the injustices at Maximus, workers have been left with no other choice than to go on strike, disrupting services for millions of Americans. As the president of CWA, we are committed to standing with the Maximus workers in your righteous fight for respect, dignity, and a better future for their families and communities as long as it takes. We are here and we have your backs because members of CWA and the workers at Maximus call centers know when we fight, we win. When we fight, we win. When we fight, we win, and we're going to win.
Come out those doors and have the faith, the courage to stand. And that's the only way we're going to get something did. You know, just sitting there, it's not going to work. Just come out the doors and strike with us. And I would like to thank everybody for attending this meeting, and this will conclude the meeting. Thank you, guys.